I am Dr. Sarita. I'll be discussing the anomalies related to the truncus arteriosus. Truncus arteriosus is divided by aorticopulmonary septum into pulmonary trunk and ascending aorta. Truncus arteriosus is the cranial end of embryonic heart tube. Failure or abnormal migration of cardiac neural crest cells to form the aorticopulmonary septum leads to the congenital heart disease. The various defects of aorticopulmonary septum is septal defects 1, that leads to the persistent truncus arteriosus, failure of aorticopulmonary septum, tetralogy of Fallot, anterior encephalic deviation of aorticopulmonary septum, double outlet of right ventricle, abnormal deviation of aorticopulmonary septum. The second type of aorticopulmonary septum is the spiral defects. Aorticopulmonary septum runs a straight course. It can lead to detransposition of great vessels. LO bulboventricular looping or abnormal looping can lead to L transposition of great vessels. Coming to the first and the most important congenital anomaly, that is the persistent truncus arteriosus. It is a cyanotic congenital heart defect present at the time of birth. Truncus arteriosus, most of the time this defect occurs spontaneously. Genetic disorders and teratogens have been associated as possible causes. Truncus arteriosus is generally considered as a failure of septation in the ventricular outflow tracts, semilunar valves, aorta and pulmonary arteries, leading to common trunk or common arterial trunk, that is the truncus arteriosus arising from the heart, and this common trunk is continuous with ascending aorta and the pulmonary trunk. Embryological process of truncus arteriosus is mainly due to the failure of conotruncal septum or aorticopulmonary septum. This is mainly due to the disruption of normal migration of neural crest cells, which is crucial for the septation of great vessels, that is the ascending aorta and the pulmonary trunk, which forms the outflow tracts, leaving one large embryonic vessel, a single arterial trunk arising from the right ventricle and left ventricle. And the valve is also single truncal valve. This truncus arteriosus overrides the ventricular septal defect. Single arterial trunk arising from the heart provides mixed blood to the coronary arteries, pulmonary arteries and aorta, the systemic circulation. Systemic and pulmonary blood mix at the ventricular septal defect and desaturated blood is ejected into these outflow tracts. The classifications of truncal arteriosus. There are two types of classification, Collett and Edward and Van Parack. These mainly depend upon the origin of the pulmonary trunk or its important branches. Coming to the management of truncus arteriosus, it requires early neonatal surgical repair, typically performed within the first week of life to prevent retractable cardiac failure. The second important anomaly is tetralogy of Fallot, TOF. It's also common cyanotic cardiac lesion as it results in an inadequate flow of blood to the lungs for oxygenation. Embryology of tetralogy of Fallot is mainly anterior encephaloid deviation of aorticopulmonary septum, which is mainly due to the abnormal migration of neural crest cells towards the truncus arteriosus. And this leads to the two important features, that is overriding of aorta, pulmonary stenosis and ventricular septal defect. Tetralogy of Fallot is recognized by spectrum of outflow tract element anomalies. It is classically characterized by four important features. 1. The pulmonary stenosis. 2. Overriding of aorta. 3. Ventricular septal defect. And 4 is mainly the right ventricular hypertrophy. Chest radiograph demonstrates the boot-shaped heart apex is lifted up and thereby the concavity in the region of pulmonary artery in relation to tetralogy of Fallot. The third important congenital cyanotic heart disease, that is double outlet of right ventricle, represented as DORV. Both aorta and pulmonary artery arise from the right ventricle. Embryology related to double outlet right ventricle is mainly the abnormality of leftward shift of conotruncal outflow tract in the process of looping of embryonic heart. Is an impaired morphogenesis in the outflow tract. The double outlet is usually also associated with ventricular septal defect. A double outlet right ventricle, the two major arteries, the ascending aorta and the pulmonary trunk, are linked with right ventricle. Left ventricle has with no artery at all. It's also associated with ventricular septal defect. Body mainly receives oxygen poor blood. The fourth important type of truncus arteriosus anomalies is a transposition of great vessels. There are two types of transposition: D transposition of great arteries and L transposition of great arteries, which is also known as congenital corrected transposition of great arteries. Transposition of great arteries, the dextrotransposition of great arteries, which is represented as DTGA, the position of two arteries leaving the heart are switched off. This mainly due to the conotruncal septal defect during the development. The second type of transposition of great arteries is the congenital corrected transposition of great vessels. Levotransposition of great vessels, or CC transposition of great artery. In this case, the position of two ventricles of the heart chambers are reversed. This is mainly due to the abnormal looping of heart tube during development. Dextrotransposition of great arteries is a cyanotic heart defect, conotruncal malformation, a life-threatening congenital condition present at the birth. Condition occurs in approximately 5 into 10,000 births. Transposition of great vessels, that is DGA, embryological aspect, the spiral septum or the conotruncal septum, which divides the truncus arteriosus into ascending aorta and pulmonary trunk, follows a parallel course instead of spiral course in such a way that aorta arises from right ventricle and pulmonary trunk from the left ventricle. Embryological discordance of aorta and pulmonary trunk. Transposition of great arteries. The pulmonary artery or the trunk is connected to the left ventricle and oxygen-rich blood goes to the lungs and to the left side of the heart without being pumped to the rest of the body. On the other hand, aorta is connected to the right ventricle and oxygen poor blood goes to the right goes from the right side of the heart to the aorta and to the rest of the body. Lack of sufficient blood flow to the systemic circulation causes apoxia to the brain. The next type is the congenital corrected transposition of great vessels. In a normal heart, the aorta, ascending aorta, lies posterior to the main pulmonary trunk. In congenital corrected transposition of great vessels, the aorta lies anterior and to the left of main pulmonary trunk. Congenital corrected transposition of great vessels sometimes associated with dextrocardia. In congenital corrected transversion of great arteries, the features are both atrioventricular and ventriculo-arterial discordance, and discordance is known as double discordance. Embryologically, this condition results in levo-bulbo-ventricular looping or abnormal looping. Normally, the straight heart tube has the de-looping of the heart tube which is related to the ventricles. In such cases, the left ventricle is towards the left and right ventricle which is derived from bulbus cordis is towards the right. In case of congenital corrected transversion of great arteries, the straight heart tube has a L loop or the reverse looping or abnormal looping which leads to inverted ventricles. Left ventricle is on the right side and right ventricle is on the left side. In corrected transversion of great arteries, the right atrium is connected to the left ventricle and it is connected to the pulmonary artery and it's related to the pulmonary circulation. On the hand, left atrium is connected to the right ventricle and it is connected to the aorta, the systemic circulation. Right ventricle therefore acts as a systemic ventricle and is bound to have difficulty in tackling the systemic pressure in later part of the life. It is not uncommon to observe progressive right ventricular dysfunction and tricuspid regurgitation over a time. The ultrasonography showing the D-transversion of great arteries and L-transversion of great arteries. Clinical correlation coming to the transposition of great vessels, diagnosed usually during ultrasound in both antenatal and postnatal period. Evaluation of transposition of great arteries typically includes imaging modalities such as echocardiographs and magnetic resonance image to assess the cardiac anatomy. Treatment options may involve surgical correction for transposition of great arteries which is incompatible with life. L transposition of great arteries. Surgical approach is to correct this defect is not always recommended. Thank you.